Hi guys, today I'm going to show you how to do a pulse reading with a pulse oximeter. Sometimes we refer to it as pulse ox. So first of all, I want to tell you a pulse ox is a test used to measure the oxygen level, oxygen saturation of your blood. So it's very easy, very painless measure of how well oxygen is being sent to parts of your body, your heart, your legs, etc. So I have a gentleman here. He's going to measure his oxygen level.
First off, I would stick my finger inside of it, which I notice there's no pain.
No, it's painless.
Then I push the top button, and it gives me a reading.
What's your oxygen level?
I have to turn it around. Oxygen level is 97, and my pulse is 87.
Which is your heartbeat, your heart rate.
Is that a good reading?
Yeah, if you have a reading in the upper 90s, 95 between 100 is typically good. But if you have a reading 90 or less, don't panic. It's okay. So you can recheck it again, or you can use it on somebody else to compare. So I wouldn't panic.
Well, it seems like a very small unit. I can put this in my pocket, bathroom, and so on.
Correct.
And is it over the counter?
Yes, you don't need a prescription to buy a pulse oximeter.
What's the approximate cost of this?
It's usually, the price ranges from $19 up to $80.
It's pretty reasonable for what it does.
Mm-hmm.
Let me ask you something. A person who smokes, is that an issue with this?
Yes. You're not going to have an accurate reading if you are a smoker. So if you are a smoker, you should stop smoking.
What about wet hands?
Your hands should not be wet.
Well, people have perspired through their hands. Would that be an issue with this?
Yeah. If you have poor circulation, that can give you a false reading. Another thing that gives you false reading is high intensity ambient lighting, excessive motion, and it should be the device should be at the level of your heart.
So the basic thing is, when I'm using this right now, I put my finger in here, push the button. I should be still, and also keep this basically at heart level.
Exactly.
Okay. Does it matter which hand it's on?
No, you can use any hand, but it's if you put it in the left hand, so you'll be able to use your right hand. Also, your finger, you can use any finger. In the hospital, I noticed the respiratory therapists or the nurses, they always use the index finger. But as a matter of fact, you can use your index finger, your middle finger, your pinky. You still will have an accurate reading.
So in other words, you don't have to have fingers to use this.
If you don't, you're so silly. If you don't have fingers, you can use your toes.
Or you could use your ear, I assume.
Yeah, there's a device you can use on your ears, even your forehead. But for now, this one is very convenient. You can use it with your fingers.
It's very lightweight, also.
Yeah, it's very lightweight. This is what healthcare provider use. So it's not a bad idea to have it during the coronavirus.
Yes, that's another thing I wanted to say. What's a bad reading if you have or you suspect that you could have the coronavirus or COVID-19?
If you suspect you have COVID-19, the best thing to do is to monitor your symptoms. Cough, shortness of breath, fever. But I remember when Chris Cuomo was tested positive for the coronavirus or COVID-19, he said he had that device at home and he monitored his oxygen saturation throughout the day. So since it's an expensive device, it's not a bad idea to have it. So
in other words, you don't have to be a Chris Cuomo to afford one of these.
no, it's very cheap. You know, whatever you can afford, from $19 up to $80. Thank
you for answering all my questions and letting me know how to use this properly.
Yeah. So in summary, a pulse oximeter is a way to measure how much oxygen your blood is carrying. So by using this small device, your blood oxygen level can be checked at home without needing to be stuck with a needle. Because in the hospital, when they check your blood saturation, oxygen level, they have to stick your finger with a needle to take your blood gas. So that can be painful and very inconvenient, very invasive. So at home, it's a good way to monitor, to check your oxygen level. So, do you have any more questions?
None. And you've answered everything. Thank you very much for your time.
Thank you, guys. Guys, don't forget to subscribe to the channel. Give me a thumbs up if you like the video. And if you don't like the video, put a comment and let me know how I can improve on future video. So I hope you have a safe and good day. So ciao.